back to the second episode of season 2 of Lives, Thrives and Mental Health Dives. I am here with the stunningly gorgeous and successful Dr Natalie Haworth over here. Mother of 4, businesswoman, doctor. She really does have it all. And today we are here to spill the tea, aren't we, really? On, I think quite a lot of people have a lot of questions to do with aesthetics. It's definitely like a growing trend.
Yeah.
And something that I feel like I was in the wilderness about until, of course, we met was like skincare. What do you need? I'm now 31. What do people need to do preventative-wise? What do they need to do, what's the things you actually need rather than having 29 products that you don't? And we are going to touch, of course, on a bit of a controversial topic, which is, should you be letting the person who does your nails inject your face?
I have some very strong opinions on that.
You have some strong opinions on that. Yeah. So let's start off with just what kind of age would you say you would recommend people to start getting aesthetic treatment if they wanted to? Nobody needs it. Everyone's gorgeous. But if you wanted to.
I like that little caveat you gave around nobody needs it. And that's something I probably use constantly in clinic. When patients say, what do I need? I say, well, let's get rid of that word.
Yeah.
You need antibiotics when you're poorly. You don't need aesthetic treatment.
Yes.
I like the term, what would you benefit from?
Yes.
It's a little bit kinder. And it sets the tone for our relationship.
Yeah, of course.
Legal age is 18. That was. You can't believe that was in the past few years, actually, that was legalised.
That was not before then?
That was not. That was in the past, I want to say 3 years, that it was made illegal for under 18s to seek injectable aesthetic treatment.
That's crazy.
Absolutely mind-blowing.
Yeah.
I know myself, I've been doing this a long time, and a lot of my colleagues, over 18 has been a rule for us and certainly for me. Yeah. And that's all around consent.
But even 18 to me
18
sounds crazy.
It is. It's kind of... it's the legal age for a lot of other things. I think they would struggle to say, well, you can own a home, drink alcohol at 18, but you can't have a bit of Botox.
Yeah.
And my kind of stance on that is always with injectables. We don't treat your age, we treat your skin. So as long as you're legal, it's about your genetic predisposition, your, sun damage, things like that. And preventative treatments can be as little as using a glycolic acid. Yeah. So that can just be an at-home, over-the-counter treatment where we go right up to much more aggressive treatments.
Which is like the med grade.
Exactly.
But we were talking before, weren't we, about how many people say I want to help with my skin, but batter the sunbeds and vape and smoke and whatever.
Well, this is hopefully something that is changing over the past couple of years, and I suppose certainly over the past 12 months. Patients want to have that wellness conversation. So I can say to them, right, okay, what are we doing with your skin? We might be doing your toxin today, but what's happening with your skin? And, you're not using sunbeds if they've declared that in the sort of consent form. Or if I can just smell the Hawaiian coming off the skin.
That burnt flesh
smell. I'll say, you've been to the sunbed this morning. Well, I thought I'd go on before I came.
Yeah.
And it's that kind of slap your face moment of, it's not reversing it sort of physically, chemically. It's just counterintuitive.
I mean, I have to say, I've never been a sunbed worshipper. I'm more than happy to fake tan and stuff like that. I do tan if I go away, but again, I still use my sun cream and everything. I'm not an oil. I'm not a rotisserie chicken, as I call them. But I was partial to a cheeky vape until recently. Like when I'd had a drink, I was like, woohoo. And I've completely packed that in now.
And vaping is, again, an unknown. We don't have the evidence on it. It's not a long-term, kind of recreational use. We don't know what the long-term effects of vaping are.
Yeah.
But what we do know, short-term wise, doing this constantly
all the time
is going to give you increased lines around your mouth. Yeah. Reducing the hyaluronic acid in the area. So just the physical.
Makes your breath stink. Did you?
I didn't know that. I didn't know that.
I did because I've been watching documentaries on it. But yeah.
Well, that's why you start.
That's where it starts. Yeah.
I was a sunbedder.
Were you?
Absolute irony is I paid for my med degree by working in a sunbed shop. The irony.
That is crazy.
I worked for 5 years in a sunbed shop. We had competitions of who could do the longest on the bed. I think I got 18 minutes.
Do you hate yourself now?
Shock. Yeah, well, I do because I'm having to have laser on my chest to get all the sun damage off because my chest looks like Madge from Benidorm. My face is okay.
It doesn't.
So
I've seen your chest. It does not look like
You've seen my chest. It's not getting people too excited.
Yeah.
So that wellness is certainly coming into things where we're having conversations about not using sunbeds, not smoking.
Yeah.
You know, alcohol, it's kind of the S's, sleep, stress, sugar.
Yeah.
Those things need to be amended in your life. You need to think about your diet. Are we supplementing your protein enough? So you can tell the patient that comes in and is skinny fat, normal BMI, but no muscle.
Yeah.
You know, they're not doing any exercise, they're dieting. And what they don't realise is that collagen is a protein. So if you don't have enough raw protein in your diet, whether that is animal-based or plant-based, you will struggle to create collagen. You're not supplying your body with the right amount.
What is your stance on collagen supplements? Because I've seen controversial, like some of them are like, it's literally just a marketing campaign. It does absolutely nothing for you. And some people are like, I take revitalising collagen every day and I look like a 19-year-old.
The jury's still out. So I, last week, attended a journal club because I'm such a loser. And we kind of dissected a big meta-analysis. So meta-analysis is... It's an investigation of a group of papers about hydrolyzed collagen supplementation. And the reviews were mixed in terms of some papers reported improvement in fine lines and wrinkles and some didn't. And the actual quality of the data is pretty poor. So I think you can spin it the way you want it to be. You can make the narrative feed your pro and, against. My stance on it is if you can afford it, it's not harming you, and you are feeling an effect, whether that be placebo or not, why not?
Go for it.
We've just ordered some a new product to the clinic for us to test. I'm going to use it on a group of patients. We're going to document the outcome, and then we're going to see. And that's another thing that's a big thing in aesthetics. So, and you'll have this as well, Tess. People will have said this to you. And it kind of brings us into that medic, non-medics injecting world. But if your kind of diehard celebrity, influencer promotes something, you're going to go and buy it. Or, some people do. They worship influencers / celebrities. Yeah. And you get those people advocating collagen drinks, kind of powders, tablets, all sorts. And that's another thing that's unregulated in this country. Yeah. So, we are heavily regulated with things like Botox because it's a prescription on the medication, but fillers, supplementation, other things we're not. And that's something that's really dangerous. Kind of on a low level, you might just be wasting your money on some crap collagen. Yeah. But at the opposite end, I see celebrities having BBLs. So they're having, Brazilian butt lifts with fillers, 30, 40, 50 mils of very dense filler injected into your butter.
I've seen it.
That could potentially kill you. If it gets into a big blood vessel down there, ends up in your lungs or your heart, you're dead. Yeah. And where will that responsibility fall? If somebody attended a clinic on the basis of somebody from a reality TV show advertising that, where does the liability fall? Yeah, I mean, not saying by any stretch that I'm on that level, but I've obviously been approached numerous times to promote certain things. And I'm going to, blow smoke up my ass, but I'm quite morally straight on stuff like that. Even when people have messaged me before asking me if they can send me wax melts for free or whatever, I always have a rule. If I wouldn't buy it myself, then I'm not going to do it, just because I actually think of it as young, impressionable girls typically spending their hard-earned money. Exactly. And something I was actually going to say then about what you just said about the collagen supplements, and something that I really liked about you when we first met, was I don't ever think that you would just say yes to a treatment if you thought that someone genuinely didn't need it. Nope. That can sometimes be a bit of a surprise to patients, or maybe a frustration that they booked something and had in their head, I want my cheeks, chin, whatever. And then I kind of ignore the booking and go, what's bothering you? Yeah. And they'll go, something's wrong here. Or I don't like my under eye. And I'll say, okay, well, what you booked for isn't actually going to help that. And the core of that is that I'm a doctor, and I didn't get into doing what I do. I didn't spend all that time training to make money. And that seems silly because I'm a businesswoman and we own a few businesses, but that's not where I started. I started as a women's health surgeon. Yeah. And there was no profit margins to be had. And that kind of ethical, do no harm, what's in the best interest of the patient is inbuilt in every fibre of me.
Yeah.
And that means that affects my decision making on a daily basis.
Yeah.
And that's not present in people who are not medically trained.
No.
Yes,
Yeah.
you know, people can be ethical, but the constant consideration of benefit versus risk is something that is built into you during your training. You know, years and years of training of constantly saying to yourself, what's the risk, what's the benefit?
Yeah.
And do they match up? Because if the risk is too high and there's very little benefit, let's not do it.
And also, just as a side note from somebody that has had various different treatments, liked some, not liked others, even people that are medical professions can get it wrong.
Oh, absolutely.
So if you're thinking even those guys are getting it wrong,
yeah,
the person that has had no medical training is much more likely to get it wrong.
And the injecting bit's not the hard bit. Like that's physically, you could teach anybody to do it.
Yeah.
It's the looking at the patient as a whole, their past medical history, the current mental state. I've turned patients away just because they've come in and I've gone, you're not in the right place to.
Oh my God, that's me when I have a mental breakdown and then I like look at Turkish places to get my tits done. Sorry, Mum. Yeah. And then a Turkish number will message me the day after and I'll think delete.
Yeah, exactly.
Because I've been having a mental breakdown.
You're making a rash decision. And that, again, is something that comes from, we call it consent, capacity for consent. That's a specialist bit of training that we do. Can this patient make a decision about this right now in their mental state? And sometimes it's no. And I'll go, let's revisit this in 2 weeks. And they'll come back and go, oh, so glad I didn't do it because it wasn't the right thing for me. And thank you.
Yeah.
And that's just something that's not within everybody.
No.
And then the flip side of it is I always say to patients or people when we have these conversations, because it's very spicy online.
Yes. I have seen some of the stuff that
people comment on.
Well, people get very annoyed, don't they?
Of course they do. They do. They get, they see that they've done some training and this is how they're earning their money. And I get people want to just make a living for themselves. The problem isn't necessarily in the aesthetics, the way it looks when it's done. It's when the shit hits the fan. That's where it goes wrong.
It's the accountability, the legality.
Legalities, but also kind of medical consequences. So I have had several DMs, even in the past couple of weeks, going, I've been and had this done somewhere. They blocked me, they're ignoring me, or they've reviewed me and said, you're fine, and I know I'm not fine. Oh. And it can be ranging from anything from a bit of a lowbrow, and I'm like, we're off. Or it could be a full-blown vascular necrosis.
Sorry, I've seen this.
Yeah.
Did you see the infamous horror story a few years ago about someone getting nose filler and they'd injected filler into a blood vessel and their nose had almost fallen off?
This is our risk. And, the kind of argument for non-medics to say is, well, that can happen to a doctor or a nurse. Yes, it can. But the medication used to reverse that is a prescription-only medication.
And also, they're medically liable.
Liable for that, exactly.
They are taking on the responsibility.
Your reassurance for ever attending doctor, nurse, midwife, whatever, is that they hold a PIN or I have a GMC number. Mm-hmm. And that's like your baby. It's like you carry that around with pride.
It's your reputation.
Exactly.
Yeah.
Because not only it's your reputation, it's what you've worked for. They will come down on you. You will end up hauled in front of a council, in front of a panel of people going, why did you do this? What? And it will put your career at risk. It puts your GMC number on the line. Yeah. So there's always the reassurance with any medical professional that you're never going to bang your head against a brick wall. Even if they block you, you will go, right, let's go to the NMC, the GMC, the GDC for dentists. Yeah. I wasn't happy with what that doctor, nurse, dentist did to me. No. And I'd like you to know about it. And then you'll get a contact within 6 weeks going, come on, tell us what you did. That does not exist for non-medics. There is no regulatory body in the UK for aesthetic treatment. What is the
actual laws now on the...
There isn't. That's the problem.
So it needs to be tightened, basically.
Does. And, there's people who have been campaigning for this for years and years and years. And now there is a group called the JCCP who are trying to regulate within the UK. Mm-hmm. The problem that they've got is they set out from the beginning and kind of said, we're not going to ban it for non-medics, which... To me, it's not the right way to go. No. And they created a register and it's a voluntary register and they opened it up to non-medics and medics. And people like myself went, you know what? No, I'm not being put on a register with people that aren't medically trained when I've done 7 years of training, paid 50 odd grand for a degree. I'm highly qualified and specialised in what I do for you to
intelligent.
Exactly. And also pay for it.
Yeah.
Pay for, again, to be on another register. I pay for my GMC. I pay for lots of regulatory bodies to look after my clinic, to come in and go, this is legit. You know, you are doing the right thing with your waste, your cleanliness and hygiene, your staff are looked after well, your patient records are what they should be, your follow-up is great. To then voluntarily register to do it again just to satisfy the government in their lack of regulation. It's not happening for me. And I will push back on that. That's something that I'll die on that hill.
But I mean, it's great to stand up for like what you believe in, and I certainly see, like, now that you've explained it how you have, why it is such a controversial topic. But I don't then understand, maybe this is going to get me barbecued, but like, why some people are such advocates for the other side. Like, unless it was like you saying, you know, it's my income, etc., which I get. Everyone deserves to earn a crust in life. I am fully behind that. But I wonder why people get so abhorrently
I think you hit the nail on the head about it being financial, because you make a lot of money. You can make a lot of money in aesthetics. And I think it's a highly profitable industry and people want a slice of it, don't they? They kind of see, well, you're doing it, I want it. And what goes hand in hand is, generally speaking, like you said, the girl that does your nails because in that industry, those patient groups are similar. So you can recruit from your lash, you know, database to then do the toxin and do the fillers and things. And the other argument, which can kind of, it's dupes people into thinking, oh yeah, actually that's true, is that beauticians will say, well, you go on a 2-day course like me. Yeah, okay, but I also did 7 years prior to that.
Sorry, right? So they're like, we've done the same training.
And I'm like, your 2-day course does not compete with my medical degree in any way, shape or form. And I train medical doctors, nurses, dentists in aesthetics. And you can see, they come in, they can put a pair of gloves on. They know how to pick up a needle. They know about ANTT, which is cleanliness and hygiene. They know how to put sharps, to use sharps safely. They know how to have bedside manner with patients. They know about consent. The basics are there.
The other thing is, and I mean, this is probably a bit to say, but like, I feel like I can tell when people have had bad work done by people that aren't as medically experienced or qualified. And this kind of ties into something that your business is also big on, which is the facial balancing thing. Because I myself have had like, this when I was first starting to try out aesthetics. So I was about 26 when I first tried Botox. And I went to somewhere that it wasn't a medical person. And she was like, yeah, you need X amount of units. I was 26. Let that be the reminding factor. So she did the full 3 areas, and I was so frozen here that all of a sudden these became so deep, because the lower part of my face couldn't move upwards, and I looked deformed, honestly, right? If you ask my friends, I went to one of my friends' weddings and I turned up and I remember Lauren Finch, shout out, was like, don't get that done again. And I was like, why? Frozen mask here.
Why?
I was like, why? And she was just like, oh God. So I am actually speaking from experience. Now, on the playing kind of devil's advocate side, I've also had very good work done by people. There's someone that did my lips a couple of times. I don't have my lips done anymore because I'm over that look.
A lot of people are.
But she was always great, and her clinic, is that what you call it if they're not medical? Her
still people call them clinics,
was always great. It was very clean. She was great. She's taught me through everything. So maybe it is just down to like person, but I can understand that the majority isn't.
No. And the thing is, someone said to me the other day who was trying to advocate for kind of non-medic injectors, and she said, you know, what if they did go on an ANTT course and a consent course? So go and be a nurse then.
Yeah, go and be a nurse.
Go and do it. If you want to do it to that extent, go and do a degree or a diploma or whatever. If you're going to spend all your time doing that, then do it properly and get, you know. And I know people who are doing that, who have done that, who've gone, you know, I do want to do aesthetics and I want to do it properly. So let's get the background kind of foundation training in medical procedures, and then we can do aesthetics afterwards. And I'm kind of all for that. People think this is a competitive thing, and I want to be like,
oh, you think that's why people come for you, because they think that you're trying to
I'm being competitive and I want all the patients, and then I think,
there's
enough business for everyone. Your patients. I don't want those people. That's another thing. I attract. This is what we call in aesthetics, like you've got a Tinder profile,
right?
So Nurse Kate told me this. She was like, your Tinder profile is your socials. You put out what you want to attract. And there are patients I want to attract who want that natural enhancement, who don't want to look like they've anything done. And there are patients out there who do want to look like they've had things done.
Yeah.
They do have a certain look about them.
Yeah.
They're not for me.
And that's okay.
That's fine. That's
your
somebody
look.
that goes to someone else. And there are medical professionals who do that done look. Fine. Not a
that's
problem.
like anything. That's like hairdress. It's like
exactly
makeup. I do makeup and I actually really like doing the kind of like soft glam.
Yeah.
So when people have come to me in the past and they go like, I want a peacock eye.
Exactly.
It's not what I do.
You shouldn't have come to me.
Yeah.
And this is the thing. So it's not a competitive thing because there was a survey done last January. 1 in 5 people intend to have a new aesthetic treatment in the next 12 months, and the industry is worth £13.6 billion.
Wow.
There is enough patients for everyone.
Yes, there is.
So it's not about taking work away. And then I remember reading a comment saying, we should let beauticians do all the aesthetics because we need to keep doctors in the NHS. And I just thought, what a pious thing to say. Oh, I should be a martyr to the NHS because, you know, we need them. And even though they treat us like dirt and the morale is through the floor, we should let beauticians do all the aesthetics.
Venture
exactly.
Off.
You should let us do it because you need to stick in the NHS for the failings of the NHS.
Yeah.
But there is so many reasons why I'm really passionate about it. And a few years ago when I first kind of started my socials, excuse me, I was very kind of vanilla on it. It was like, you know, didn't really make comment about things and kind of was like, if people want to earn the money, that's up to them and I'll do my thing and they'll do theirs. And now when I see the messes that arrive in my clinic and the people that come in who have been harmed and botched by other people, it's also made me quite of an advocate that we need regulating as aesthetic medical professionals because there's a lack in there as well. Yeah. In terms of the GMC regulates us very widely, but I get patients who come in who've seen other doctors and other nurses who've come in and said, you know, it's not necessarily gone dramatically medically wrong. Yeah. But the bedside manner is awful. That I was oversold. Financial consent is one thing that I am very, very kind of passionate about and I hate it. I hate when patients come to me and say, I went to someone else, they examined me, treated me without really telling me what I had, and I got to the bill and it was £5,000. And I think,
my God, I would simply pass away if that was me.
I had a lady last week tell me, she went into a clinic, a well-known clinic, and was told, you need X, Y, and Z. We've started you on this course. She said I was kind of undressed, prodded and poked, treated with a machine. She said I got to the till and it was £7,000. She said I had to split it across 3 credit cards and ring my husband. He was obviously furious but upset because she was devastated. Yeah. They had to contact the GMC because they said there's no financial consent there. And that's as important as medical consent. £7,000, it's like, you know, it's a deposit on a northern house. It's a lot of money. Exactly. Yeah. And I think that for me, when sometimes my patients will go, oh, don't tell me. And I'm like, I am telling you what your bill is because I'm not having you rock up at the till and be surprised. You need to be able to afford this. You need to be able to budget it. And another thing, ongoing financial consent. So when patients come to me and say, I want this treatment, that treatment, I say, okay, this is the cost now. This is your yearly spend. Yeah. Can you afford it? You know, make sure that that's not going to come out of your
And that's
food
actually
shopping
really
budget.
important because then you're not exploiting people that can't afford it.
Exactly. And that's where the mistake is made by so many professionals because they think, it's like they think it's never going to come again. If you are ethical, patients will be attracted to you by word of mouth. Yeah. So something I teach my therapists that work in the clinic and the other doctors is there's no sell. You don't need to do a sell.
They're coming to you because they want it anyway.
They want your advice. Yeah. And if you are professional and knowledgeable and ethical, the sales is a byproduct of that. Yeah. Because the patient will be loyal to you and want to invest in what you say because you know what you're talking about.
And also, I think like what you just said about the kickback that maybe sometimes you get on social media and before you were a bit vanilla and you didn't really have a stance. I think it's admirable to take a stance. And also sometimes, in my experience anyway, you get a kickback when you are a success. Yeah. Because it seems to be a trigger point for some people.
This is it. No, and I've, since the end of January, had my socials have literally exploded. Yeah. It's that thing where people talk about it online. You find your hook, and my reel found a hook. Right. And I've gained 8,000 followers in like a few weeks. Yeah. But it drags in the trolls.
Yeah, it drags in the trolls.
Drags them in. And I buy. I can't help it. I buy. But then equally that drives the engagement. And I'm always polite. You know, I'm kind of will correct people.
I'm a bit the same. When people argue with me on social media, I would never be like, listen, you're fucking this, that and the other. I'm just like, all right, if that's your opinion, that's fine.
And I'm polite about it. And I might be a little bit kind of sarcastic sometimes.
Yeah.
But you know what? And I'm sure, I know you've had this. It genuinely makes me worry about some people that, you know, you just said I've got 4 kids and clinics and stuff. Some days I think, oh, I haven't had a drink or a wee today. And I think, who has time to sit and formulate negative thoughts about someone else and then actually write them down? Actually comment on...
We touched on this briefly when I had the Finch twins here. Because I was just kind of saying, like, I'm sure we're all guilty of being like, what on earth has she had that haircut for?
Exactly.
But I put that in my WhatsApp group. I don't like message. And it's not, I'm not comparing myself to these types of people, but it's like, you know, when like the cast of Geordie Shore or whoever would be like, I get so many messages of hatred. I can't imagine messaging like a TV personality like, just so you know your hair looks crap. I can't imagine doing that.
Honestly, it just makes you think, who are these people and what are their mental health problems to make them do that? I don't think I've ever like... Sometimes, like you said, I might think something. There's somebody that keeps coming up on my sponsored like ads because I must have clicked on something. And it's an absolute bullshit treatment for wrinkles and lines. And I've read through some of her stuff and I want to go, that's not evidence-based. What a lot of shit.
But you're not going to comment.
Not going to do it. Not going to do it. It's going to stay in my head and I'm going to carry on with my day because I've got more important stuff to do. And even if it was true bullshit, it's not really harming anyone. So what I always think, what's going to be the consequences of what I do?
It's also the classic, if you don't like it, don't follow me.
Exactly.
People have commented on my pictures before like, God, you're so annoying. And I think, don't look at my pictures then.
Scroll on. Carry on. It's bizarre what these people kind of... And the DM bit. DMing someone, and I, you know, the people who out them but cover the names, I think, no,
that's not me getting
not me.
out there.
You're getting outed. It's that classic thing of the more you talk about, the more you find out. You want to comment on, I had someone DM me saying, oh, you shouldn't reply to people because it just feeds them. And I'm like, no, if you're gonna say something, be prepared for a reply.
Why shouldn't you say something?
Exactly.
They're coming and attacking your way of life and your business.
And this, it wasn't even something kind of like aesthetic. It was, oh, your use of English language is terrible. And I was like, oh, I know. Listen, I know. It's not my strongest point. But they'd made a lot of spelling mistakes. So it was really difficult not to go and be like,
pot calling kettle.
Exactly.
Yeah, well, it's funny because I remember my dad and I have had this discussion before because my dad sometimes, like, especially when we were younger, I feel like I'm exposing my dad here, but like he would name call a bit. Like when I was young, he'd kind of be like, and this is why you're being an idiot, you're doing this, you're doing that. And I remember getting to a certain age and I said to him like, Dad, you know when you call me an idiot or you call me this, that, I was like, you've actually lost the argument. And he was like, what do you mean? And I was like, right, well, say we were arguing over whether that was a fork or a spoon. And I went, well, it's a fork. And you went, well, no, it's a spoon. And I went, well, you're ugly anyway.
Exactly.
What's that to do with that?
No.
And I think that about the whole, like, look at you can't even spell. Why do you give a shit? Why do you give a shit?
Well, my reply was, got me through med school though, didn't it? And people are like, you're being bitchy. I'm like, it's not bitchy, it's
the truth.
It's true.
I
still, despite my shocking spelling and grammar and sentence construction.
That's what autocorrect's for, you guys. Exactly. That's what Grammarly's for.
I still got a degree out of it. And, you know, my patients don't give a crap if I can't spell, I can inject.
They care about having their faces balanced.
That's it.
But speaking, let's just reference back to the skin thing that we talked about at the start. So we've talked about preventative.
Yes.
Now, since turning 30, and I'm sure that there's other girlies out there watching this or listening to this, that this world of skincare is an absolute minefield.
It is because it gets unregulated.
Yes, and I see you post quite a lot about like sandwiching, lots of different products. Just briefly, if you can be brief with it, what would you recommend is like a must have for somebody or in a skincare routine? Because I remember when I asked you about this, you were like double cleansing was like one. And then
SPF.
And what are the things that you could probably scrimp on and get generalized product maybe from Boots, and what would you suggest if you were going to invest?
To invest in?
Yeah.
So SPFs, as long as they have the rating on them, you can get whatever you want. As long as it's 30 or 50.
And that's a must-have.
It's a must-have. That's, if you don't use SPF, don't bother with Botox, don't bother with fillers, because it's pointless. The sun causes 85 to 90% of our aging. So if you're not blocking that out, then it's absolutely pointless.
Yeah.
And the world of SPF is so wide nowadays that you can get tinted ones, you can get creams, you can get gels, you can get physical ones, give you a bit of white casting, you can get non-physical ones, you can get powdered SPFs. There's no excuse when people go, it breaks me out. I'm like, there's an alternative, there's another one, there's an alternative, there's tons of them.
Yeah.
And if you are an outdoors girl, if you're walking dogs at lunchtime, if you're riding horses, you need to be applying it more than once.
Right.
If you're wearing makeup, powder, SPF powder over the top multiple times a day.
I didn't even know there was SPF powder.
And this is it if you don't know about it.
Yeah.
And they can be, we sell a very cost efficient range called Heliocare for £22.50.
Yeah.
We do rival Amazon on the price point, but we just can't rival them on the delivery.
Right.
So I'm always like, you're paying for our advice, please pay £8 for delivery.
Yeah.
All the way up to £60, £70 for your Zeo SPFs. Now, they're not doing a different job, but they might suit you more.
Right.
So you've got the primer by Zeo, and that might sit better under your makeup. But you might want the powder because you're outdoors all the time. And that's the price difference.
Right.
The kind of where they fit into your life. If you can just do Heliocare in the morning under your makeup and you're inside all day, fine. SPF is your bog standard.
Right.
Where you can kind of be more cost effective are your cleansers and probably your moisturisers, actually. Right. So your cleansers.
That surprises me, actually.
Yeah, exactly. And it's because not everyone needs a moisturiser. And sometimes the moisturiser is for your comfort more than anything else. When you get out of the shower and you feel that tightness, all it can be doing sometimes is alleviating the kind of the sensation, but not really doing anything to your skin. So your cleansers, you can get your CeraVe hydrating oil, CeraVe cleansers. They're sort of £12.
And they're good.
They're good.
Yeah.
Always use that as cheap as your first cleanse. So I would say something like a CeraVe wash, or for me, it's the Elemis Pro Collagen Balm. I mean, it's not cheap.
Yeah.
It's like £40, but it lasts you about 6 months.
Yeah.
And I use that when I wear makeup. It's not often I do wear makeup, but when I do, I take that off and then I do a cleanse with a Zeo wash. So if you imagine, it's a little bit like, same with, kind of, I'm not trying to word. It's like shampooing and conditioning. Like when you shampoo your hair, you should shampoo it twice. The first time takes one bit, the kind of
and that's where the double
cleansing comes in. So you take your makeup off and then you cleanse your pores afterwards.
Yeah.
Where you should be spending your money should be the things that are active. So where you need an active ingredient, that's where you should be investing.
Is this the retinol thing?
Retinols and other actives. So because retinol is a family, and it's a family of unregulated ingredients. So it's vitamin A. And vitamin A has kind of a family tree. And it goes from your kind of retinols you can buy over the counter, which can be weak retinol esters.
And would you even bother with those?
You can if you're seeing results.
Right.
And they will be kind of mild results where you get a little bit of dryness and a little bit of peeling, maybe. But because they're unregulated and they're in the family, they're allowed to be labelled retinols even when they're not.
Right, okay.
So eventually it becomes a retinol, but it's got to be broken down, and the chain of it being broken down weakens its effect. Where you go all the way up to the other end of the spectrum and you've got prescription-only retinoids. So it's very confusing. They've got very similar names.
It's very and even confusing. I find it confusing, and I consider myself someone that's quite competent, especially with beauty. Like I'm always like, oh, it's this, and I know what I'm doing.
So there is a family tree, and the closer you get to the bottom, the more potent that ingredient's going to be. And the most potent one you can get really topically is tretinoin, and that's something we can prescribe in clinic. But this is a highly potent, serious topical ointment where you don't want to be kind of playing with it. And this is where sandwiching comes in. So any retinol in the family can be sandwiched. So we always say to patients, okay, you want to start on retinol. How aggressive do you want to be? If you want to be kind of, oh no, I'm not into the downside, the downtime and the side effects, fine, we'll put you on a week.
Because it takes a while to build up a tolerance,
yes,
is that right?
Exactly.
Yeah.
Whereas tretinoin, you will find you are dry and a bit sensitive and a bit flaky initially, but you can reduce that effect by sandwiching. So you put moisturiser on first, then you mix your tretinoin moisturiser, and then you put that on, and then you put moisturiser on again. So you're creating a tretinoin sandwich. And what you should do is reduce the mixture until you're just putting tretinoin on your skin. And that might take up to 12 weeks for it to kind of get to that point.
And then does it get to a point after the flaky, sensitive skin part where all of a sudden you just...
Yes, and you're shiny and you're smooth and your lines and wrinkles are much better. And tretinoin has what we call a Cochrane review. So it's got a very, very high level of evidence base behind it.
Right.
So there's a Cochrane review that says that it is effective as an anti-aging regime. And off the top of my head, someone might correct me, there is no other ingredient in cosmeceuticals world that has that body of evidence behind it. And you look at some of the befores and afters with these high-strength retinoids, and they're akin to Botox. They could have, you could say that was a Botox before and after, but it's not for the faint-hearted because you do get those kind of downsides.
Yeah.
The other active ingredients, so your glycolic, salicylic, azelaic acids, yes, do reach for your medical grade. Now, medical grade is a bit of a strange term because we use it quite loosely to describe any products that you can only access through a clinic. But really, it isn't a term that has a definition.
Right.
So I would say any skincare that you can't access via Google would be considered medical grade. Right. So you have to have a consultation.
Yeah, you have to go to somewhere
else to go through them. And it's because the potency of the ingredients could be damaging. And that's another flip side of thing. My 8-year-old last week asked me for some drunk elephant.
Oh my God, I've heard all about this.
And I was like, what's she been watching? Some YouTube stuff. And I was like, no, babe, you'll use your CeraVe moisturiser because that's all you need because you're 8.
Yes.
But equally, there's some bits that you can buy over the counter. So the ordinary BHA has caused some chemical burns.
My gosh.
I mean, I don't want to get sued, so it's literally on Google. But you've got to be concerned about the potency of even some of the over-the-counter products and how they can be damaging to skin, and certainly to underage skin. Using these...
I have seen the drunk elephant trend at the moment. Well, so I actually worked at Santa's Grotto in the lead up to Christmas, very last minute, don't ask. And every time I kept asking children, like, what are you asking Father Christmas for? Loads of them were like, I'm asking for... what was it? Serums.
Serum, yeah.
Serum, this, that, and the other. And I'm looking at these children thinking, serum.
Exactly. What do you need that for?
Yeah.
You've got the serum of youth. Why do you need that?
But I really want to start my retinol journey.
Yeah.
But I've said to you, haven't I, that I'm going to come in and we're going to discuss because I'm clueless.
Yeah.
And it's a minefield.
This is it. And it's about... why I do encourage people to seek even just a consultation for the skin is you can be kind of handheld through it. Give you a really strict regime, not necessarily strict regime, but a regime that you can follow, that you can adapt to your lifestyle, because it's all well and good being sold 8 products to use a day, but if you've not looked at lifestyle factors like the fact that you're a night shift worker or you've got 8 kids, and you've got to consider it being used.
And also what you said before about like good diet and water drinking, it all ties in
together.
But just to summarise for the people looking directly in the camera, so you said double cleanse. Your cleansers can be
your first cleanse can be an over-the-counter. It's just to take your makeup off. Take your makeup off with it.
Your second cleanser can be something a bit more of like a balm.
Bit more of an investment. It should be something that actually you wash with, that gets washed off.
Right.
So if you're using like a Pro Collagen balm to take your makeup off, you've used a cloth to take that off, haven't you?
Yeah.
You actually need to be washing it off of your skin.
Yes.
Yep.
Moisturisers, you said they could be budget.
They can be budget, and by budget that can, they can start from like Aldi moisturiser all the way up to
I saw a TikTok the other day that said that the actual ingredients of Nivea cream, the original one, and La Mer
are the same. Yeah,
and the same.
Exactly. It's bonkers what marketing can do for you, isn't it? Oh my
flipping God. I saw it and I thought, what the hell? And I told my mum and she was like, your grandma used Nivea cream for years, and it was fantastic.
Exactly. And she looks 21 and she's 90.
So I can maybe actually see then how a more budget-friendly moisturiser can be.
Exactly, because it's going to plump out your hyaluronic acid. Your hyaluronic acid in your dermis is hydrophilic. It attracts water. It's what is kind of your hydrating element of your skin. It holds the water in. But it doesn't necessarily need to be something expensive to do that. If you have a barrier problem, so this is the difference. If you just need a generic moisturiser because you've got unproblematic skin, you can go budget.
Yeah.
If you have a barrier problem, so you've become sensitised, you've got dry skin, you've got flaky skin, it's sore, it's red, that's when you need to come in and have a chat with us, because barrier repair is slightly different to just plain moisturising. Yeah. And that might be that you're actually over exfoliating chemically and physically, or it might be that you've got the wrong SPF and it's got a sensitising ingredient within that SPF that we need to eliminate and then repair your barrier and then start again. So there's lots of different things that come into moisturising, because it's why do you need a moisturiser? And people with oily skin kind of have a bit of a, they don't want to take a moisturiser away, and we say, oil and moisture is not quite the same thing. So sebum production that gives you spots and like oiliness around your nose, that's not the same as your hyaluronic acid level. So moisture and oil are slightly different as well. Yeah.
So unless you have like a barrier problem, moisturiser can be a budget one. If not, needs review.
Yes. Exactly.
Actives, definitely
need get help with them. And it might be that if you say an investment is always best when you're getting active products, because we know that what it says on the bottle is in it. It's been tested, it's been dermatologically tested, and we know that that's exactly what it says it is. If you come in and say to us, which we can work with, I've got a really limited budget, but what can £100 a month get me, or whatever, we will signpost you to out of clinic treatments. And God, Alan Sugar would probably be like, what a stupid business, buddy. But I couldn't think of like a business person. It's a bit of a who that, isn't it?
Yeah, but I knew what you meant.
Kind of a business person would say, well, that's not a very profit-making industry. But we might signpost you to Amazon and go and get this. It's actually pretty good stuff. And until you can afford, because that's the thing, it's again about maintaining it. You might be able to spend £300 on 6 products with us, but then if you can't top them up,
what's the point?
What's the point?
It's about like kind of religiously, isn't it?
Keeping on top of them, and that's it. Consistency is free, but it's going to make the biggest difference with your skincare. So I think I posted about this recently and said, you can't double cleanse on a Monday and then use a baby wipe on a Friday and expect results, because your skin is a constantly cycling kind of organ, and people always go, well, your skin doesn't know you're asleep, but that's when it does its repair. That's when it does all of its work, is in the night. And if it's got makeup on, it's sat in the pores when it's trying to kind of cleanse itself, if you will, and get rid of those dead skin cells overnight. It's not going to happen when it's got a layer of Estee Lauder on top of it.
No. And then, of course, the most important one that you mentioned,
SPF, and things like sunglasses. So squinting in the sun is going to give you frown lines.
Because I'm also blind. Yes. It's actually my New Year's resolution to get contact lenses this year.
Contact lenses, or prescription sunglasses, because people don't want to put them on because they want to use the normal glasses. Because
I sometimes just wear my glasses with my sunglasses over the top. I'm that person.
Cool.
Yeah.
Things like that. Just practical things.
Yeah, but I think that's going to be really helpful actually for listeners, because again, like I keep saying, I find skincare such a Jumanji, and I think that people will find that really interesting. Yeah, okay, so to wrap up, thank you very much for coming here today, Dr. Natalie. If you want to go and find Natalie's social media page, you've got 2, don't you?
We've got the clinic, which is the Doctor and Company, and mine is Dr. Natalie Haworth.
Get following those 2 and come on down.
Come and have a
for facial balancing done by a medical professional and some skincare advice, medically prescribed things.
You might see me one day like marching down Parliament Street.
I know, yeah. You might see you with your little flag and your little badge.
Exactly.
But yeah, so until next time, thank you very much. See you later.